Hi everybody, let's talk about the video I posted yesterday about the range of normal swallow onset, meaning the bolus can reach as deep as the piriform sinus is before a swallow starts. Great discussion, thank you guys for contributing, but there's something pretty interesting that has come up about it. Namely, people are saying, why is it that people think that I can't detect whether or not there's a swallow onset delay without instrumentals? And I'd like to address that because that question suggests that there is a lack of knowledge in terms of how a swallow actually initiates. I'm going to break it down this way. Swallow response time is also known as swallow reaction time. So if you have a reaction time, you need what? A go signal and some representation that a movement has begun. In our case, the representation that the movement has begun is the forward and upward burst of hyoid activity that then arcs forward and comes back down, that happens unique to a swallow. And the reason that's the case is because back in 1956 and since then, several studies have shown that the mylohyoid and geniohyoid are among the first to fire. If you know what those are, then you know that they actually pull the hyoid forward. So the hyoid is a representation of the brain that's patterned those muscles to move first. So that's the first thing. Some people say they can feel that with their fingers. Don't have time for that fight. But let's talk about the other point, and that would be the stimulus. A swallow is a reflex, meaning it requires a sensory stimulus in order to initiate. With that being the case, the whole point in understanding whether or not there's a delay is to know where that bolus was relative to the physical representation that the swallow started, which, as I just said, is hyoid burst. Now, was the bolus in the oral cavity? Was the bolus in the vallecula? Was the bolus in the piriforms? How do you know without seeing where the bolus is? And if you're going to suggest that you can tell where the bolus is, then we have a big problem, and here's why. We are supposed to be a skilled profession. That means we know what we can do and we know what we can't do. And the things we can't do, we don't say we can do because it makes us appear as though we don't know what we're doing. So we need to be very careful about suggesting that we can actually detect that, meaning swallow onset time relative to bolus position at the bedside, when it's already sketchy to suggest that you can tell definitely when the swallow happened, but it is especially questionable if you're suggesting that you know exactly where the bolus was when you felt something against your fingers. So let's think very carefully about this. The other thing is, just because somebody told you you can do it, it doesn't mean you can. I feel like your mom a little bit. Everyone goes jumping off the cliff. Are you going to go too? Think about the bolus going over the proverbial cliff. And just because everybody else says I can tell where it is, does that mean you can too? Or maybe is everybody else unsure and unclear about what their jobs are and what's possible? Let's talk about that. All right, guys. Bye.